Hello, my name is Kelsey Gardapi. The topic I have chosen for my speech is congenital muscular torticollis. The reason I have chosen this topic is I am a doctor of physical therapy, so I have experience working with children with this diagnosis and feel that the education is very important in order preventing further cases of torticollis. A little bit of background about torticollis. It is defined as abnormal neck posturing. The term is Latin for a twisted neck. It is actually the third most common muscular congenital abnormality behind clubbed foot and hip dysplasia. The incidence has increased with the SIDS Back to Sleep program. Parents are placing their children on their back to sleep, and kids often turn their head while they're sleeping, which causes a tightness of their neck. Torticollis often occurs with another term called plagiocephaly. This is a flattening of the head. Plagiocephaly is a flattening on one side or the other. There are other flattening that can occur, brachiocephaly, which is flattening of the back of the head, or scaphencephaly, which is a flattening of both sides of the head. Torticollis is caused by a unilateral tightening of the sternocleidomastoid muscle. The sternocleidomastoid muscle runs from your mastoid down to your clavicle and into your sternum, as shown in this diagram. The etiology of congenital muscular torticollis is largely unknown. There are several thought processes. They say that mostly it occurs in utero, causing by an injury to the muscle, sometimes a rupture to the muscle. Some feel that it may be a neurological injury to the muscle, but largely it is unknown. Clinical features include a laterally flexed head to one side and then rotated to the uninvolved side. So if it's the left side that's involved, the head will be tilted to the left and rotated over to the right. And you also see the plagiocephaly often, a decrease in neck range of motion, so the child will have a difficulty turning their head to the opposite side, and there may be a tightness in the sternocleidomastoid muscle, or a tumor may also be present. If not treated, kids may have craniofacial asymmetries. One ear may be pushed forward compared to the other. Sometimes you may have one eye socket kind of bulging out. There's also incidences of scoliosis that is related to torticollis. Delayed motor development and feeding problems may also occur. Treatment options include physical therapy, surgical intervention, or a cranial remolding helmet, which is used for the plagiocephaly. It looks like a small football helmet that is used to put pressure on the side of the head that is bulging out to decrease the flatness. As a physical therapist, we go in and do an evaluation to see which side of the neck is involved. We check the kids' range of motion and their strength. We look at their positioning when they sleep, when they're eating, how the parents are holding and carrying them, what kind of position they are in when they're in such equipment as swings or bouncer seats. We also look at their motor development, if they are typical for their age group. Then we assist the parents with developing a positioning program, usually showing them how to sleep on one side during the night by using pillows or other devices to help keep the child on their side, to keep the pressure off the side of the head that would be flat. We also teach them how to use towel rolls and those kind of things to keep the head in an optimal position in car seats and swings. Then we also teach a stretching program, which parents must complete during the day, usually 6 to 8 times, in order to get the neck stretched out so that children may hold their head in a midline position. As the child continues to grow and develop, we will provide the parents with different exercises to help them with their weight shifting, which is important for crawling and walking, teaching the child how to use both upper extremity. A lot of times they will favor one side or the other. Usually they will favor the side that they are looking towards. And mostly we provide lots of parent education. A lot of parents, especially young parents, aren't aware of torticollis or its effects, especially long-term effects that it may have on a child. So as a physical therapist, our most important intervention is to provide education to the parents. Overall, early intervention is the most important key for torticollis to help with prevention of further delays or complications that can be associated with torticollis. Intervention through education of physicians and parents is very optimal for decreasing the number of incidences of muscular congenital torticollis. Thank you.